Hey, it's Jane. How you doing? I'll assume you're doing good. Um, where to start? I am tearing my whole place apart because I have an endoscope and I want to look inside and have a look at what's going on in there. And I thought, oh yeah, no problem. Like in the last video, I showed you how a disaster the room was. I'm like, oh yeah, no problem. At the end of my bed, I've got some trunks. It's in one of those trunks for sure. I've been through those trunks and it's not in there, which means it has to be in a box with books, and I have 36 boxes of books. Shit. So yeah, I don't know when the hell I'm going to be able to, because I wanted to do like, because it's an endoscope that does 1080p video, right? So, um, uh, not only do I want to get a look inside for see how things are looking, see how things are coming along in there, but also to share, because I don't think I've seen any actual endoscopic footage from inside somebody's um, vaginal cavity. Um, but yeah, I don't know when I'm gonna find the endoscope now. It's oh my god, it's chaos. Um, so where are we? Um, as I said in the last video, everything is really great. And I'm past the post-surgical recovery period, in the sense that, um, there are problem areas. I think there might be one or two stitches left, but they're in innocuous places where they don't get any tension, so they'll eventually break and fall out, and they don't really mean anything. All of the important stitches are broken. In fact, a couple days ago, I think like the last, not important stitch, but the last stitch in a place of tension during dilating broke. Um, and I knew it broke because it hurt. um, so yeah, I think pretty much all but a couple of the stitches are gone completely. The little area at the bottom, I'm going to say it's closed with quotation marks, because um, I can touch it and there's absolutely no stinginess to it. It is kind of like jaggedy because, um, I mean, it's hard to describe if you've never seen it, but if you have a large sutured area that opens up and stays open, there's structure underneath the skin that will form like bubbles and kind of spheroid shapes, and and because it's right down at this V, right? As things heal, everything gets compressed more and more and more. So all those little spheroids that were in this open area at the bottom, well, not open, it was open because there was no skin over top of it. Um, all these little spheroids that were in there, these lumpy bits that were in there, and they weren't white or anything. So this wasn't like scar tissue or fibrin or anything like that. This was just the lumpy stuff you would find under skin if you peeled the skin off and left it off. But anyways, as it all came together, they started getting squished kind of flat, kind of wedged shape. And I've noticed now that they are quickly diminishing down. So um, it essentially, the whole surface is like down in that little crease down at the very bottom. is becoming like this area, maybe a triangular area about that big, that big. That's basically just scar tissue, but it looks okay. It's not white or anything like that. It's pink and anyways, I'm calling it closed up enough because I can touch it. When it was before, when it would sting, I'm calling that open because that hurts. But if I can touch it when I'm like, when I'm cleaning after douching, um, if once I'm cleaning with the anti um, antibiotic soap, um, if I can touch it with my fingers and it doesn't sting at all, then I'm calling it like as good as closed up. So those little nodules that were got squished flat and then are now diminishing down to nothing. So I think it's all just going to be pretty much a smooth valley in there, um, you know, within a week or two, I guess. Everything around my clitoris is perfectly normal. All the stitches seem to have broken on the labia minora, so that's still got divots in it where the stitches used to be, but I think that'll all even out over time. Um, it all looks correct. It all looks what you would expect to see, like anatomically correct. Um, Peeing is still kind of all over the place. Not as bad as it was, but yeah, still not getting like just a solid stream. But then at the same time, the labia majora are still have some swelling in them, and they still need to flatten out, and that's going to take some time. Um, but well, I don't know how much time it's going to take because here's the thing, right? Like like you know they say it takes a whole year for everything to completely heal, and I'm not going to say that they're incorrect, but I am a unusually fast healer, right? So like I stopped bleeding after 2 weeks. Now I don't know about other people. Maybe people um, could be bleeding longer. I don't know. They were talking to us like you could have bleeding up to 6 weeks afterwards. My eyes, I get tiny little bits of spotting every now and then, but that's usually because of aggressive dilating, which really just amounts to, um, you know, a few broken capillaries, which is nothing. Like capillaries come and go. That it means literally nothing. So I have basically haven't had any bleeding since the second week. Um, so I don't know. I would say I would be surprised if there was much change after maybe 6 months, because I mean, like, where am I now, right? I'm at like 5 weeks post-op. 5 weeks, like that's not long, and I'm already like dilating aggressively, and I'll get to that. I want to show this thing. I showed a picture on Blue Sky. I want to show this thing, but at the same time, I don't know how YouTube is gonna like it because it's authentic looking. And anybody who knows me on Blue Sky knows exactly what I'm talking about. Um, so yeah, I'm kind of jumping around here a bit. I'm not really very organized. So the clitoris labia minora are perfectly good. The urinary tract opening, I think, is probably still settling down a bit. um, and my labia majora are definitely, the swelling is going down in them fairly quickly, which is kind of, I don't know. I want to say I don't like the look of it because the swelling is going down, but the skin on the outside obviously doesn't shrink as fast. Like imagine like, if you lose weight fast, right? If you lose a ton of weight fast, then you end up with all this flabby skin kind of hanging off you, kind of like the donut I'm working on here. Um, um, this is gonna be gone for spring. I need to do some exercise because I'm a little ripply around the middle. Um, when you lose a lot of weight fast, then you've got all this loose skin, and it takes time for the skin to shrink down. That's the problem that I have with my labia majora. The swelling is going down fast, which means the skin is kind of flabby and wobbly, and it's really not pleasant to look at. So, and I do know that takes time to settle down, like, because it's the same thing, right? Like if you lose weight fast and you've got wobbly skin, you gotta wait on. It's the same thing. Skin will shrink a lot slower than the the swollen tissue underneath. But right now, yeah, I don't like the look of it. It's not very aesthetically pleasing, but I'm sure it'll work itself out in time. Um, I had started applying vitamin E oil to the scar lines a while back, but that was when I still had the opening at the bottom, and then I got that bacterial infection, and I immediately stopped using the vitamin E oil because I mean, I can't know, right, if that oil is the cause of the problem, exacerbating the problem, certainly not helping the problem. So I had stopped using the vitamin E oil. I was taking vitamin E uh, um, caplets, so I was taking it internally, but I wasn't applying it externally. Um, but I did start yesterday reapplying the vitamin E oil on the suture lines because I am now officially saying that the bottom is closed up and is just kind of settling down into its final shape. Because again, I can touch it and it doesn't sting, so I'm calling that good. So I'm starting to put the vitamin E oil back on the suture lines. Um, I find that I respond very well to vitamin E oil. Cause I cut myself a lot, just because I'm working with my hands. I'm rough and tumble. I'm scraping myself up and cutting myself all the time. So I use vitamin E oil quite frequently, and I find it really does work well for my body. My skin really does like it. So I've started applying it, and I've also ordered a vibrator that is definitely usable for pleasurable purposes, but also has the ball end on one end, so that it can just be like used as kind of a general muscle vibrator. And I'm going to use that on my suture lines because the thing with the elastins that build up, the fibrins that build up in scar tissue, is you need to constantly work them and stretch them and whatnot. And I do that with my fingers. I'm constantly stretching them and working them with my fingers. But I also think, don't know this for sure. It's an experiment. All of this is an experiment for me because I've never done this before. But I think that using a massage vibrator basically directly on the suture lines along with uh, like manual um, uh, um, massaging, manual massaging with my fingers, and the vibration as well. I think the two together might be helpful in speeding up the kind of softening and reducing the lumpiness and the hardness of the suture lines. Um, because if I can get all of this stuff in good shape quickly, like why not, right? Like if I can learn different techniques for, you know, optimizing my, um, I don't know, my capacity down there. Uh, why not? Why not do it, right? You know, um, I mean, that's my personality, anyways. I'm a competitive person by nature, so I'm kind of competing with the rules. Like, it takes so long to heal and all this sort of stuff. And I'm like, well, yeah, well, I can do it faster. I don't know if I've mentioned this in the last. Yes, I did. No, I didn't. I don't know. I don't remember if I mentioned this in the last video or not. So I'm going to mention it again or for the first time. One or the other. So on the 1st of January, I decided I'm switching to dilating 3 times a day because that's sufficient. Um, uh, the healing is done. The healing is done. And now it's all about making the structures conform to what they're supposed to be in the final state. I am going to, regardless of the pace of my healing, I am still going to do the dilation schedule exactly as it's prescribed. So the way it's prescribed from GRS Montreal is you do it 4 times a day for the first month, and then you do it 3 times a day for the next 2 months, and then you do it 2 times a day for the next 3 months, and then you do it once a day for the next 6 months. And that takes you to the 1 year mark, and then at the 1 year mark, you can go down to dilating once a week. I am doing that schedule. Regardless of what my healing is like, I am doing that schedule because there's a big difference between healing, which I do quickly, and um, um, body training, which I don't know that it's even a good idea to rush. Um, like if you want to be an athlete, right? Like if you go hard and heavy at the beginning, you're going to run yourself into the ground, and it's, it's not ultimately going to be very good. You have to work up at a steady pace, and when you get there, you got to keep on going. So when you find your pace for your exercise of interest, you have to stick to it, and you got to, you're pushing yourself, but you're always pushing yourself by a little bit every time. Not huge pushes, but little bit of pushes. So, and I'm doing the same thing with the post recovery physical training of the rest of the process, right? So from now to the end of the first year, I'm sticking to the schedule, but I'm doing it in a I'm treating it more like exercise than I am um, surgical recovery. Basically, is what I'm getting at. So, what does that mean in terms of having a um, a new vagina, right? Well, depth is obviously super important, and working the floor muscles, okay? And they're separate things. They are separate things from one another. So for depth, I mean, really, depth is all about pushing inwards. Um, but it's not quite that simple because um, you want to push inwards, but you also want to push in and out at the same time. That's why I'm working with larger dilators than normal, because um, I want to I want the cavity to be the same width all the way in. If I were to stick with the old dilators, they taper down at the end, right? And I don't want the top of my vaginal cavity to be narrower than the bottom. I want it all to be the same. Um, so I'm working on a new dilating schedule. So again, I'm now on 3 times a day, and I will be 3 times a day for the next 2 months. So January and February are all going to be 3 times a day, and I've changed the amount of time that I'm spending dilating because I can dilate for longer because it's not uncomfortable to dilate. So if I can dilate for longer, I might as well. I did describe this. I remember I did describe this last time, but I'm going to go over it again because I've added in a new tool to the mix, which is, yeah, I'm going to just bring it on camera really quickly and then take it off camera because it's so obvious what it is. But I will explain why it actually is beneficial, um, regardless of its aesthetics. So, yeah, my official schedule is I do 15 minutes. I do 15 minutes of the 35 millimeter, right? And I just put it in for as far as it'll go. Apply a little bit of pressure, but nothing excessive, and just leave it sit there for 15 minutes. That just kind of gets everything, warmed up and getting used to being stretched. And then I switch to the 41 millimeter for 15 minutes. And again, I don't push in too hard with this one because the purpose of this is about you know pushing outwards, not about going in. So that goes in for the second 15-minute period. And then the third 15-minute period, I go back to the 35, only this time because the bigger one has been spent 15 minutes stretching out. This one will actually go in, and it goes in like almost all the way. Like I'd say like about where my thumb where my thumb is basically what's sticking out. Um, and that's for the last 15 minutes. And no discomfort afterwards, no soreness, no nothing. And that's perfectly fine. And I can keep doing that. And in fact, at some point, I'm going to ask the question, can I do more? Right? Like, if that's easy peasy for 45 minutes, those two dilators for 45 minutes, 3 times a day, if that's easy peasy, can I do more? Can I do, like, what is it that I can do to do more? Okay? So it comes down to two things, basically depth and the suppleness of your floor muscles. Now, with depth, the depth the surgeon gives you is essentially the depth you have. I can comfortably say that I have increased my depth by probably about 5%. Could I get it to 10%? I don't know. I'm gonna try, but that to me seems aspirational. I think it's realistic that you can stretch beyond what the surgeon gives you 5%, but I think 10% is aspirational. That's not a lot of difference. Because if you have a cavity that's, so what is that? Uh, that's like 5.5 inches, right? So I basically have 5.5 inches, and I think I probably had like 5.25 inches before, right? Could I go any farther? It doesn't feel like it. Um, and that's hard to explain because unless you've got these things inside your body and you are feeling around, like, because when you stick it in, right, you don't have to just stick it in. You can move it around, right? You can force the end to go up and down and to the sides. You can leave the end in the spot and then move the outside bit around. There's a lot of wiggle room to move it around. I mean, the cavity size is the cavity size. It you can't really make it bigger beyond what it's willing to stretch. And as I'm saying, 5% stretch I think is realistic. 10% I don't think is realistic. Um, but you can move it around in there, right? And when you do move it around in there, you can feel stuff. Like you can feel the insides of your hips, and you can feel um, um, uh, your colon, and you can feel your prostate. And, you can feel the structures in there when you're wiggling this thing around, right? Um, so there's a lot of play involved, even though you do have a limit to your depth. There's still a lot of play involved in what can go what you can do inside there, right? And that's mostly like this. Basically, the 35. That's what you're going to be doing this with. You're in any kind of moving around and stretching and like lateral stretching, right? Lateral movement and getting it used to going back and forth. That's all going to be happening with something narrower like a 35. The 41, when it's in there, like it goes in, and you can't move it around very much because it's just everything's so tight. But once this is in, your pivot point is your floor muscle. So there's let's say there's my floor muscle right there, right? No, let's go right there. There's my floor muscle right there. Okay. So the bit that is outside the floor muscle is still inside the labia, and then what's inside the floor muscle is inside the body. So when you're moving this thing around, you're moving it around with the floor muscle as the axis of movement, right? Um, and I think it's good to move it around. I think it's good to explore and to stretch and to, as long as you're not hurting yourself, as long as you're not causing bleeding, as long as you don't have any unusual discharge, right? Like excessive discharge or yellow discharge when you do, like, because right now I've got clear discharge, right? So as long as you don't have any bleeding, you don't have any pain, you don't have any discomfort afterwards, you don't have any weird discharge, you can explore. You can stretch and pull and twist and, right? You can do stuff with it. Um, and that's pretty much all I got to say about like the cavity itself. But then the next thing is the actual floor muscles. Now, floor muscles are a different story entirely, because the floor muscles didn't have an opening in them before, because there was no opening there before, right? Like the erectile tissues of the penis go down through the floor muscles, but the floor muscles form around them, and that gets opened up and opened up, and you now have this new cavity, like opening in the floor muscles that wasn't there before. So you're forcing the floor muscles apart to the side, right? Like the floor muscles are like that, and you're forcing them open like that, right? And there's scar tissue in there, right? There's scar tissue in those floor muscles because they have been cut, they have been shaped, they have been stitched, and all sorts of stuff going on, right? So they've got scar tissue, so they've got fibrin in them. You're asking them to bend in a way that they didn't originally want to. So if you talk to any bodybuilder, right, they'll tell you, like, it's incredible what you can train muscles to do. And when you look at some bodybuilders and some of the muscles they've got, it's like, Jesus, I didn't even know those muscles existed. Right? It's incredible what you can train muscles to do, and this is the exact same thing. So you want the muscles to be supple so that objects can go in, and hey, to each their own, right? Like I'm heterosexual, so I have sex with men. I have sex with cis men, so I'm used to the standard male anatomy, and that's what's going in there. It's going to be a penis, and I want it to be comfortable for myself and also for my partner. But it could be, it could be anything. It could be a dildo. It could be anything at all, right? It's entirely up to you. But you do have to train those floor muscles to be used to stretching and bending in ways that they don't necessarily want to. And so to that end, I have bought something that is intimidating looking, but surprisingly comfortable and fits. God, I hope I don't get. I don't want this video taken down, so I'm just going to bring it up. I'm just going to show it really fast, and then discuss it. So there it is. Okay, that's it. Show's over. It's bigger than the 41, but not a lot bigger, and it's latex, so it's squishy, which this is like, this is hard plastic. This has no give to it whatsoever. This is good at forcing your floor muscles open, but it isn't necessarily good at working your floor muscles. So, like any muscle, it has to be worked in a way that makes sense for its usage, right? So, I'm going to say I have two routines. One is 15 on the 35, 15 on the 41, and then back to 15 on the 35, pushed in as far as it'll go to just to work on depth. Okay, that's routine 1. Routine 2 is 15 minutes on the 35, just to kind of warm up. 15 minutes on the 41 to get the floor muscles used to being out, but not worrying about depth so much. And then 15 minutes on the the monster. And only half of that fits in, right? Because again, I, again, right? That's my total depth, right? Which is about, yeah, it's half the length of that thing. Um, so that doesn't all go in. That'll never happen. And I don't necessarily want to meet that guy. Yeah. Anyways, but what's good about it is because it is actually shaped like a penis. Penises are wider than they are tall, right? They're not circular. They are wider than they are tall. Um, so that's what this shape is, and that's good because I can go in sideways so that the thick part is vertical, which puts less tension on my floor muscles, right? But does get me that full depth. So it goes in as far as it'll go. And the nice soft round end is so much nicer than the hard plastic end. The nice soft round end feels so much better at the very top. But I can go in sideways so that the width is vertical, right? And it's quite comfortable and it'll go in all the way. And then I can turn it, I can rotate it 90 degrees, and I really feel it stretch my floor muscles, because width wise, it's like even when it's compressed, like when it's not compressed, it's like, I don't know, 46 millimeters. When it's compressed, it's not smaller than the 41. I think it's bigger than the 41 because it feels bigger than the 41. Um, but I can do that. So for the last 15 minutes, it goes in, and I'm pushing in to work on depth, which is comfortable because it's nice and soft at the end. But I'm also rotating it 90 degrees. Like, I'll do like a minute at a time. So each minute I'll rotate it 90 degrees so that I'm constantly working those floor muscles, but not consistently so that it makes them achy. They get a rest, and then they do some work, and then they get a rest, and then they do some work. And that's what I'm doing with that. And I just started yesterday, literally. Yeah, last night and this morning are the only two sessions I've used it, and I really feel like the floor muscles are getting a solid workout with it, which is good, which is what I want, because I want those floor. First of all, I want those fibrins in the floor muscles to be stretching and to break down, and so that the floor muscles can be supple, because I don't want that scar tissue in the floor muscles to cause me problems down the road. So constantly stretching it by rotating it 90 degrees does help break up those fibrins, and also it trains the muscle to know that it's going to be stretching side to side as well as vertically, but more stretching side to side. I'm training the muscle to get used to that. So that's the routine now, and I'm going to stick with it. I don't think I'm going to change it. I don't really see how I can change the routine. This seems pretty optimal to me. Because again, right? Like, there are limitations on what you're working with. The depth I have is the depth I have. It's not going to magically get deeper unless I get a revision surgery, which I do want to do a sigmoid revision surgery at some point in the future, but that's going to be like a couple years down the road. So that's not even on my radar at this point. Right now, it's just about making this cavity as comfortable and functional as I possibly can, and to get those scar tissues, softened up and reduced, and the fibrins broken up, and yeah, you know, because when it comes time to actually be sexually active again, I I don't want any problems. I want it to be comfortable and pleasurable, and just be. I want it to. I want it to be something that can be spontaneous, and not something I have to plan for. You know, because that's the thing before. Because I mean, I've been sexually active with men for years, right? So you can imagine, there's cleaning. You gotta clean out beforehand. There's a lot of prep involved with sex before bottom surgery, and it's just, I've always hated it. Like, not the sex. Sex was great, but the prep, the clean, the prep. I always hated it. It's a pain in the ass. Just to use a euphemism. Um, uh, yeah. So I want this to be such that when the time comes, everything is everything is nice and loose and limber and stretchable, and I want to be able to, you know, spontaneously have sex without having to like dilate before to loosen things up. You know what I mean? Because that kind of takes away from the mood and all of that. So, um, so yeah. So from this point forward, I mean, it's mostly an exercise thing, um, and which is which is good. It's good. I'm happy with where I am, um, and yeah, and exercise to get rid of the Christmas spare tire too, which is bugging me. Other stuff, yeah, I'm closer to getting. I don't know. It seems so simple, but I've got so much crap, and I've got so little space to work with, and I'm just shuffling stuff around. And um, I thought I would find that endoscope super fast, and now it's turned out that I'm not going to find it super fast. So, yeah, not sure. Yeah, I feel a little bit defeated, quite frankly, with the amount of progress I've made around here. Because also, too, I ran out of steam, right? Like, I do start doing some work, and I get like a half an hour into something, and I start feeling tired. And then, like, an hour is as far as I can go before I have to rest. And I'm making excuses, which also bothers me because I would rather be productive than make excuses, and I'm making excuses. So, but as soon as I find that endoscope, I will make a video, and hopefully it will be viewable. Like the quality of the video will be good enough that I can actually, post it. Um, I'll try and post it on YouTube once I can, and if I can't, then I'll just do a 60-second clip on Blue Sky. I don't know. We'll see. But finding that endoscope is very high on my list of priorities because I really do want to see what it looks like inside. I want to see the suture lines inside. I want to look if there's any fibrin buildup inside. Yeah, and that's the only way to see that is to get in there and have a look, and an endoscope is the best tool for the job. So that is it, I think. Yeah, that's it. So I love y'all, and I will talk to you again real soon. Okay, bye. Oh, no, over there.